Hi, my name is Nika Seidman, and I am a clinical fellow in family planning at University of California, San Francisco.
I'm Angela Kashuba. I'm a clinical pharmacologist at the University of North Carolina at Chapel Hill.
And we're here today to talk this morning about women and PrEP, particularly in the lower genital tract. And really, we're so grateful to Angela to give us some insight into this subject, which has been pretty confusing given recent literature. So I wanted to start by asking you just in general what we know and what we don't know about the influences of women, basically the differences in women and PrEP when they're using it vaginally.
So if we look at oral PrEP, so Truvada, tenofovir with emtricitabine, we know that that drug distributes very differently in the female genital tract compared to colorectal tissue, for example. So the concentrations of drug in the female genital tract are quite a bit lower than colorectal tissue, which translates into women needing to have much higher adherence to daily PrEP than men do. The iPrex study and also now the IPerGay study have shown that intermittent dosing of PrEP seems to work for men who have sex with men, whereas other studies have demonstrated that similar rates of adherence, a couple of doses per week, do not work in women.
And why do we think that might be?
It really relates to the concentration of drug in the female genital tract. So women need to take the drug consistently in order to achieve high levels of drug, or levels of drug that are high enough to protect cells from HIV infection.
Beyond just taking the pill consistently, does it mean anything about how long women need to take a pill before the pill is effective for them?
Yeah, that's a really good question. The CDC has some guidelines out now on how long a person should be on PrEP before it becomes protective. And those data are really based on what we know about the drug accumulation in cells in the blood. And we know that at some point in time, when a person takes a drug, the amount of drug that's going into the body equals the same amount of drug that's going out of the body, and that's called a steady state level. So the CDC guidelines are really based on at what point people achieve a steady state level of drug in the blood. It may not relate to how long it takes for drug to become effective in mucosal tissue, in vaginal tissue, or colorectal tissue. So people are doing studies currently to try and understand exactly how long that takes. It's probably not that long, but we don't know exactly yet how long it would take for a woman to take daily PrEP before she is completely protected from HIV infection.
Shifting gears a little bit, we know that women have both anal and vaginal sex. Do we know if women's concentration of the drug in the rectum changes, is different from men?
So we've done a little bit of work in that area, and we've looked at tenofovir, emtricitabine, raltegravir, and maraviroc. And with those 4 drugs, we haven't seen any differences in concentration in colorectal tissue between men and women. So we think that for anal sex, what appears to work for men should also work for women.
Well, that's reassuring. So what do we need to know moving forward to advance the field of women in PrEP?
So I think what we really need to know is what level of drug really protects women from HIV infection. So the same dose of drug for HIV treatment may not be the same dose of drug that you need for prevention, and we've seen that with IPerGay. So that is one thing that is really important and really allows us to optimize dosing strategies in women. So the pharmacology is really important. Other things that we need to know are what other choices are available for women. We've seen that the pills may not work for all women. The gel may not work for all women. And so these other strategies that are being investigated, long-acting injectables or rings or films, are also options I think that might be acceptable to some women. So I think moving forward, we also need a range of options for women.
Absolutely. Well, thank you so much, and thank you so much for advancing the field.
Thank you.